You no doubt have been inundated with statistics about the rising cost of healthcare in Massachusetts and nationwide. At Children's, we are doing something about it. While children don't need care as often as adults, when they do, it is much more complicated and costly to provide. On average, children are twice as sick as adults when hospitalized, requiring more nurses, highly specialized equipment, and more pharmacists to reformulate medication. Since we care for 90% of the sickest children in Massachusetts and serve as the community hospital for Boston, we have a responsibility to tackle the cost of health care head-on.
That's why, in the past year, Children's and its physicians have voluntarily lowered our rates and our prices to Massachusetts insurers by over $81 million. And at the same time, we also absorbed over $25 million of Medicaid cuts, all without cutting services or sacrificing the quality of the life-giving care we offer. Reducing the cost of care is not simple, and it requires multiple approaches, from reducing the cost of care for each unit to delivering care in the lowest cost setting, such as a physician office or a community hospital, to reducing unnecessary care, to preventing disease in the first place. At Children's, we're tackling all four of these approaches. To reduce the cost of care, we've been tightening our belts, taking at least $58 million out of our budget over the past 2 years, and we've targeted at least that amount for next year. We have a number of efforts to increase our efficiency, including the more productive use of our operating rooms, quicker turnover of beds, and reducing emergency room waits. All of these reduce the cost of care to our patients and improve the patient's experience overall.
Let me give you two great examples of reducing utilization, providing care in a lower cost setting, and prevention, all working together to reduce costs. Our home hydration program enables kids receiving chemotherapy to get IV hydration at home instead of in the hospital, saving patients more than 750 nights in the hospital, totaling $900,000 in savings. And our asthma initiative, which sends nurses to make changes in families' homes to reduce attacks, cut hospitalization by 83% and emergency department visits by 65%. Perhaps as important, kids in the program have missed nearly 40% less school, and their parents have missed 49% fewer workdays.
However, we cannot do it alone, because reducing the cost of care while improving quality is so complex. We've created a partnership with the local 3 major insurers and state Medicaid to develop new, sustainable ways to better deliver care. As one example of this collaborative effort, we've launched an initiative to enhance coordination between our neurologists and the pediatricians in the community to better diagnose and treat children with headaches, which is a very common reason for doctor visits to the pediatrician and to our specialty neurologists. Our goal is to reduce the number of brain imaging tests and have the pediatricians work in consultation with the neurologists to manage more of those patient cases.
Providing the best, most innovative care is what Children's Hospital Boston is all about. Innovation drives improvements in care and service from the research bench to the bedside. It has also helped us to drive savings in the healthcare system, while at the same time providing world-class care to every child. We believe the unique value that we bring to our patients, their families, and society is to provide high-quality care, exceptional service, and innovation at a reasonable cost. We promise to continue to deliver on all components of this important equation.